Welcome to Mayo Clinic Q&A. I'm Dr. Sanj Kakar. After 2 months of elective surgeries being delayed due to the COVID-19 pandemic, executive orders are slowly being lifted and patients are now able to pursue treatment, including elective surgery. What's different for patients when having surgery during the coronavirus era, and what steps are being taken to keep our patients safe? Joining us to discuss this is Chair of Surgery at Mayo Clinic, Dr. Michael Kendrick. Dr. Kendrick, welcome to the program.
Thank you. It's a pleasure to be here.
So Dr. Kendrick, when the stay-at-home orders were implemented, how did that affect the surgical practice here at Mayo Clinic?
Quite significantly for several reasons. As you know, the executive order asked us to not do elective operations, but in addition to that, there were significant concerns initially just about the modeling of a projected large surge, the availability of personal protective equipment to protect both patients and staff, and then really not knowing about a lot about the transmission behavior of the virus. And so initially we had ramped down to doing almost exclusively just emergent surgery. So as you know, the executive order allowed for more than that, but without the appropriate ability to test and keep patients safe, we felt we needed to go further than that initially. And so it reduced our practice significantly by 75 or 80% at the low.
So as you mentioned, we were still taking care of our emergent and trauma patients. And so in terms of the surgical practice, how did things sort of change there in terms of how we were keeping the patients and our staff safe?
Things definitely evolved. Initially we were trying to do our best with the best evidence and recommendations, both from within the clinic, from our ID specialists, but as well as from government agencies and local authorities. And so testing initially was focused on those emergent cases, and so the patients requiring emergent operations. And over time, however, though, with more testing availability, with different protocols that we felt provided added safety, masking, all kinds of different things evolved during that time we were taking care of those patients, which actually is what gave us the confidence to move forward, taking care of some of what we called the urgent patients, which were clearly patients we could provide care to, but had previously been a little bit nervous about, wanting to make sure that first and foremost their safety was at the forefront.
So one of the things that we know at Mayo Clinic is how innovative our staff is. So now with the executive order being lifted, how are we safely taking care of our patients as we open up the surgical practice?
It's a great question, and I would say we've learned a lot over the last 8 weeks that has allowed us with this ability to take care of more patients, those with elective conditions. We feel much more confident based on several things. So over this time period, as I mentioned, we've been able to implement widely safety precautions, both for patients and staff, universal masking for everyone on the campus, PCR testing, so nasal swab testing for patients before any operation that occurs in the operating environment, in the operating room. And so these things have given us confidence. Some of the data that we've gathered along the way has also given us confidence. So for instance, during this time period, as we have honed in and refined the screening and the testing protocols and our processes within the operating room, we've seen much less exposures, dramatically less exposures. Again, just showing that this can be done very safely. The number of exposures is very small. And as you know, with the flattening of the curve in the community, we feel the community is safe as well. And so this has allowed us to feel very confident that we can take excellent care of those with COVID and protect those that don't have the COVID.
So Dr. Kendrick, you alluded to the testing before coming to the hospital, and obviously our patients get a pre-visit screening call as well. Once they arrive on campus, what do they experience as they sort of go through the process getting ready for their elective surgery?
Yeah, so as you mentioned, in addition to the screening, many of the patients that will come for an operative procedure will also be tested. Certainly all of those that come to the operating rooms. And so when they get there that morning, they've already had negative tests. Many of them have self-quarantined since that test to make sure that they're safe as well. The staff are all masked. The patients are cared for as if any one of them could have COVID. So we make sure that all of the touch points between the time they come into the hospital and throughout their entire stay, staff are taking care not to expose them and not to be exposed. And so when the patient gets to the preoperative area, it's very similar with the exception of more masking and very visible safety precautions. Once they get to the operating room, there we have very clear protocols that allow us to put them under general anesthetic safely and protect not just them but the staff. Once the operation starts, it's really not much different. We still provide the same great quality care that we do. It really hasn't changed the operation itself per se, but even after the operation is over, as they're coming out of general anesthetic and cared for, we're taking lots of special precautions to protect both them and the staff.
Yeah, I was in surgery yesterday and I could see that myself, when the patients come through, how everybody is masked, the attention to detail for the cleanliness is obviously there. And as you said, once they're in the operating room, there's plenty of personal protective equipment for us to do the procedure safely, and also giving the care that the patients have expected to get at Mayo Clinic.
Again, yeah, those are great points. And as you know, in an operating room, we maintain a sterile field all the time anyway. And so, like I said, once the operation actually starts, everyone's gloved and masked and eyewear, and it's a very very safe environment in any situation, COVID or not.
And one of the things that we also do after surgery is obviously take care of our patients in terms of their post-operative visits. Have you noticed a change in your practice, for example, in the use of telemedicine in terms of seeing the patients remotely and taking care of them?
Yes, a pretty dramatic change, even from the preoperative setting to the postoperative setting. We've really utilized both phone and video visits with patients to help limit their need to come for a face-to-face visit, certainly initially. And that we learned a lot. We learned the things that the patients liked about those types of visits, the things that the physicians liked or disliked. And so we've really changed our practice. I think this will continue for a long time, in that there are many conveniences to the patient. For instance, if they're from further away and they don't have the means or the ability to get here multiple times, we try and take care of everything we can with over virtual visits, and then have them come just for the necessary face-to-face or imaging, testing, other things that have to be done here, and then operate. And then, as you say, the follow-up, it depends on the patient themselves. If it's a condition where someone locally could help us, their local physician could help examine the patient or obtain some blood work, we've been very detailed about the things that would be best for the patient. And so they come back when needed, but we've really taken advantage of this opportunity to see what really is best for the patient in terms of inconvenience, cost, and necessity of traveling and being somewhere where they shouldn't necessarily be, to reduce their exposure as well.
I think you make a good point in that our patients still feel connected to us, be that if they're local or even if they're from all over the country, they still have a touch point and they can actually see us and we can see them, which I think has enhanced their care.
I think it's a great advantage in many ways for patients, and we'll want to continue that where appropriate and where desired by the patient, because you can imagine if they live several hours or further away, it's sometimes challenging for cost and time for them to come for a 30-minute appointment and some blood work that we might be able to arrange in a different way. So we're really excited about some of the positive impacts that this might have for patient care. I think one issue that we felt was very important and necessary because of the limited amount of personal protective equipment and limited understanding of the big surge that was expected to come was some of the delay that patients experienced. We didn't take that lightly. It was very difficult at times to talk to patients who had, maybe not emergent, but somewhat urgent conditions, cancers and other things that we had to delay. And fortunately, because of the way things went, we didn't have to delay very long, but that initial delay was very hard for both patients and their providers to have that conversation and know that you need care, we can provide it, but the COVID environment and lack of appropriate equipment was causing a delay. So we were really excited to be able to advance that as we got control of the PPE, the personal protective equipment situation, as we were able to develop models that showed us what resources we would need in the hospital. Right now, we have very real-time evaluations of personal protective equipment, of hospital bed resources that allow us to be much more nimble than we were when this all started in March. And I think that's an important point because, there is some expectation that we might see a increase this fall or at other times until we get more definitive treatment for COVID. And we feel much more prepared that we can stay open, especially for those patients that really need that care in a more timely fashion, even during some of those difficult times that may come.
We've been talking to Department Chair of Surgery at Mayo Clinic, Dr. Michael Kendrick, in how Mayo Clinic is safely opening the operating rooms for our elective surgical practice. Dr. Kendrick, thank you very much for joining us.
Thank you very much.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all the Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then, click on Podcasts. Thanks for listening and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.